Hello, everyone. My name is Marianne Regan. Today, I will be speaking about substance abuse and mental health disorders. As a registered nurse for the past 4.5 years, I have cared for multiple patients suffering from mental health and substance abuse disorders. Although I have experience working with both of these patient demographics, the learning from material from this week has deepened my understanding of the pathophysiology and proper treatment interventions for patients suffering with these disorders. What surprised me most from the learning materials from this week and what did not surprise me? This week deepened my understanding of substance abuse disorders greatly. Although I had a rough understanding of substance abuse disorders, I realized that I did not understand the pathophysiology behind many substance and alcohol dependence and addiction. This week also enhanced my understanding of the mode of action of many of these substances, addictive substances, which I wasn't completely clear of prior. Understanding the mode of action is imperative since it can help a practitioner predict certain unwanted complications and outcomes if an overdose occurred from these specific substances. I also learned quite a deal about the appropriate pharmacological treatment options for those suffering from alcohol and drug addictions. What did not surprise me this week is that I had a good understanding on a lot of the mental health disorders and the pathophysiology behind them. Throughout my career as both a nursing assistant and a registered nurse, I've spent quite a great deal of time working with patients who suffer from mental health disorders. And I've also always found mental health disorders to be fascinating. So when caring for these patients, I would deepen my understanding by looking these up and researching these disorders. So it wasn't a surprise for me in regarding those. 3 things I did learn about mental health disorders. Although like I said before, I have a decent understanding on many mental health disorders. This week reinforced my understanding, but also helped me develop my knowledge regarding certain specific idiosyncrasies between the disorders and how to treat them. I feel like I learned quite a bit about panic and anxiety disorders. I realized of all the disorders that were covered this week, that was probably the disorder that I understood the least. I did not completely understand the pathophysiology behind panic disorders prior to this week. And I did not realize that it was the result of an increase in discharged neurons from the temporal lobes of the brain. And I was also not aware that in generalized anxiety disorder, there was a disruption of the neurotransmitters such as GABA, norepinephrine, and serotonin. I was also unclear that bipolar disorder fell under the umbrella of depression. For quite some time, I did believe that bipolar disorder stood alone as a singular mood disorder. But I didn't realize that it was a subcategory of depression, which makes a lot of sense. Although it may seem like a simple learning point, I believe that this is an important point to have learned. And it's important to recognize that bipolar disorder does fall under the category of depression and could be helpful for practitioners when they're creating a treatment plan for patients with depression and bipolar disorder. Another learning point was observing all the treatment options for schizophrenia, depression, and generalized anxiety disorders. When I was reading our textbook, I came to realize that I frequently give first and second generation antipsychotics to patients with a history of depression and not schizophrenia. Although many of these medications are indicated for patients suffering from schizophrenia, it appears that they are also used off-label for other mental health disorders. And I'm excited to learn more about this in my pharmacology course this upcoming semester. When it comes to mental health disorders, I feel like I had a very broad and decent understanding from nursing school, but this week definitely helped solidify many of those things. 3 things that I learned about substance abuse disorders. I felt like I learned so much about substance abuse disorders this week. One of the most fascinating learning points was regarding the development of alcohol and substance dependence and addiction. I was not aware that in substance addiction and dependency, the brain programs itself in preparation of the substance, especially when people utilize substances such as alcohol and others on a daily basis. And this leads to the individual having a physiological craving for the divide and psychological craving for the desired substance. For example, the brain telling the body to increase heart rate and blood pressure for an expected exposure of a depressant substance. I found that so fascinating. And how easy it would be to create a dependence with a substance. I also found that I'm not the most informed regarding the mode of action of many substances. Understanding the mode of action and the source of a given substance is essential for practitioners to have an understanding on, since it will help the practitioner predict potential dangerous side effects, symptoms, and appropriate treatment plan in the case of an overdose. Mode of action is so important to understand, but also the source, especially when we're getting into illegal substances and how they may be mixed with other substances. So I am very glad I've had a second learning on all of those topics. And lastly, I enjoyed learning about the pharmacological treatment options for substance abuse disorders. I have a good understanding of the use of Narcan and have given it in my practice when there's been a suspected drug overdose. However, my understanding of methadone and antabuse is quite limited. Again, I remember briefly from nursing school, but it's been a while. And I find that having knowledge regarding methadone and antabuse is extremely important for a practitioner to be well versed in, especially when patients come into our care who are suffering from substance and alcohol abuse disorders. It's important so we can be educated and prescribe and help get these patients the help they need. And discuss how this will be important to how I will implement this in my practice. I am in the family nurse practitioner track, and I believe it's so essential for all providers to have a good understanding of mental health and substance abuse disorders. For my specific track, I hope to work with teenagers and young adults someday. And for this group, teenagers are and young adults are extremely impressionable and at risk for misusing drugs and alcohol due to peer pressure. And since this is such a concern for the demographic, I think it's very important for nurse practitioners and all practitioners to be able to properly educate teenagers and young adults regarding the risks of engaging in alcohol use and substance abuse use, since they're very impressionable and peer pressure can be so difficult to overcome. So I am excited to hopefully help some kids and teenagers and adults understand the risks of engaging in such practices, and also supporting mental health needs, because that is also a huge rising issue within this demographic, especially with the use of social media and coming out of this time of a pandemic. I think it's more important than ever to have a great understanding of mental health disorders. Thank you so much. I was happy to learn about all these mental health disorders and substance abuse disorders this week, and look forward to using them in my practice. Here's my one reference. I just referenced the textbook. Thank you.